Hello everyone, I am Rakibul Hasan Khan, Assistant Professor of Assam Downtown University. Today I am going to discuss about RGB contact lens, fitting parameter and fitting assessment. Fitting parameter. RGB contact lens fitting is more complex than soft contact lens. One has to have clear understanding of the lens design before learning the fitting. Here, for RGB contact lens, we need to more understand about fitting parameter, and patient also need to understand about the do's and don'ts of contact lens. Here, key factors are: number 1, patient selection. Patient should be high motivation. A highly motivated patient is more likely to be successful. Motivation is a key factor in RGB contact lens where as the initial adaptation period will not be tolerated by wearers lacking the desire to be successful. Here, highly motivated or sincere patients are suitable for RGB contact lens. Next, moderate to high prescription. Patients with a moderate to high prescription tend to be more motivated than those with a low power requirement. The desire for alternative glasses is stronger among these patients. Here, those patients are having high power. In that case, we will moderate the patient to take RGB contact lens. Next, corneal toricity. Those patients who require astigmatic visual correction are better suited to RGB contact lens as the quality of vision is superior to soft contact lens. Patients with significant against the rule corneal toricity often have less success with spherical RGB contact lens because of lens decentration and residual astigmatism. Here, those patients have cylinder power. For them, RGB contact lens is better compared to soft contact lens. So, what is corneal toricity? Toricity is usually defined as the variation of the apical curvature of the corneal meridians. The representation of a corneal surface using the biconic model allows variation of the apical curvature and sphericity of the principal meridians. Next, number 2, preliminary measurement. Number A, corneal radius of curvature. Here, corneal topography is essential for selecting the back optic zone radius for the trial contact lens fitting. The measurement is usually made with a keratometer. Number B, corneal diameter. It is useful for the lens total diameter that is most suitable for the patient. As the corneal periphery is difficult to define, horizontal visible iris diameter is used as a guide to the corneal diameter. The horizontal visible iris diameter can be measured by using a handheld millimeter ruler or by utilizing a reticle in the eyepiece of a street lamp by microscope. As a general rule, the lens total diameter will be 2.3 mm to 2.5 mm less than the horizontal visible iris diameter. Here, for corneal diameter, we will measure the horizontal visible iris diameter by normal scale or reticle in the eyepiece of street lamp. For RGP contact lens, we will select approximate 2.3 mm to 2.5 mm less than from the normal horizontal visible iris diameter. The normal horizontal visible iris diameter is 11.6 mm to 12 mm. Next, pupil size. The pupil size in both bright and dim illumination should be measured. The dilated pupil size is important for the selection of the appropriate back optic zone radius. When the optical zone is too small, significant visual disturbance may result. Number D. Spectacle refraction. Necessary to obtain precise spectacle refraction when fitting RGP contact lens. The relationship between the refraction, corneal topography and visual acuity will indicate the type of contact lens which will most suitable for the patient. Here, spectacle refraction should be perfect because it indicates the type of contact lens which will most suitable for the patient. Next, number E, trial lenses. For low and high minus. Here, a key requirement in fitting patients with RGP in large trial set. The recommended back vertex power selection is -3 diopter for the low minus and -6 diopter for the high minus power. These powers allow for the fitting of a contact lens that is close to the final power required, and as such the fitting observed with the trial contact lens will be similar to that of the ordered contact lens. Here, for minus contact lens, -3 diopter to -6 diopter, we need to check back vertex power. This power may be final power, so before order the contact lens, we should observe with the trial contact lens for patients is comfortable or not. Number B, for low and high plus power. The recommended back vertex power selection is +2 diopter for the low plus and +5 diopter for the high plus powers. The gravitational effects on the plus lens designs are significant and great care must be taken to ensure that the trial lens is close to the back vertex power required. Here, for plus lens +2 diopter to +5 diopter, we need to check back vertex power, and here must be taken care to ensure that the trial lens is close to the back vertex power required. Next, diameter. The total diameter is very important for variable fitting of contact lens. The smaller diameter of 9.20 mm and a larger diameter of 9.60 mm should be sufficient to fit the majority of patients. Number D. Back optic zone radius. A range of back optic zone radius is required from 7 to approximately 8.40 mm in 0.1 mm steps and 0.05 mm steps between the radii of 7.6 to 8.00 mm. Here, broadly speaking, there are two extreme positions that can be adopted. Number one is lead attachment, that is beak and flutter. Here we may have a lens of about 9.50 mm diameter, a back optic zone diameter of about 8.40 mm and a back optic zone radius 0.2 to 0.3 mm flatter than K. It needs to be this flat with a back optic zone radius, this size, in order to be flatter than alignment with the cornea. Essentially, the centration and movement of the contact lens is controlled by the leads, which pass the lens between upper and lower during the blink circle. Lens fitted like this do have a habit of riding a little high, especially in the long term, and exposure strain of the lower cornea is common. Number 2. Interpalpebral, small and steeper. This lens is fitted with a small total diameter and back optic zone diameter to minimize lead interference. Generally, the back optic zone radius is fitted to give some apical clearance, and this was often done by adding 25 to 30% of the corneal porosity to the flattest K, a procedure which has unfortunately persisted into alignment fitting, where it is inappropriate. Interpalpebral fits are often rather uncomfortable due to the interaction of lens edge and lead margins. Next, fitting assessment. A diagnostic lens is essential to give a trial lens for RGP. The final selection of the contact lens will be introduced by series of trial fitting contact lens. Here also we need to check the refraction is perfect or not. The detailed slit lamp examination we should check properly. Keratometric reading also we should check properly. Horizontal visible iris diameter also we need to check. Next, after the initial checkup by slit lamp and refraction, we need to select an initial trial contact lens according to the power and keratometric reading of the patient and horizontal visible iris diameter measurement. We will take for the initial trial lens and definite diameter and power. We make the patient sit for at least half an hour after putting the trial contact lens for adapting the lens in the eye. Then, when the lens is fully adapted by the patient, after that we will check the contact lens is in center or not. The movement of contact lens should be 1.5 mm to 2 mm with each blink. The movement of contact lens is smooth or not. This is called dynamic assessment of RGP contact lens. Next, we need to do static assessment of RGP contact lens also. Here we check open eye condition, the influence of eyelid on the lens. Sometimes we put fluorescent, and we will check in slit lamp, and we see the fitting of the contact lens. This assessment is done by watching the tear film beneath of the contact lens. After satisfied with the trial contact lens fitting, then we place the final order to the laboratory for final RGP contact lens. Thank you.